The 10th anniversary of the Doha Declaration is a very timely occasion to discuss the complex relationship between public health, innovation, and trade.
The symposia try to explore changes in how governance for global health should be organized. Our symposia over the years have looked at the intersection of health and development, human assistance, foreign policy, and this time, trade.
If WHO has a clear mandate to promote the right of health, WIPO and WTO have increasingly stepped up their efforts to support global strategies toward this end. The presence at this panel of the three Director Generals of WHO, WIPO, and WTO are the best illustration of their common goal and the collaboration they did develop during the last year.
Access to medicines, and I don't need to repeat what Margaret, who knows much more than me about that, is a multifaceted, multi-sectoral, multi-governance, multicultural issue. The problem of IP protection is one of these facets, but there are many others, and we need to have a holistic view, which is why joint work, cooperation between those who know in IP with their specific mandate, those who know in health with their specific mandate, and those who know in trade with their specific mandate have to work more together.
The Doha Declaration on the TRIPS agreement and public health is a major milestone, extremely important to reaffirm the right of WTO members to use the TRIPS flexibilities to protect public health.
This event was a political turning point. What was decided at the time, and that's the main part, substantial political part of this declaration, was that the TRIPS agreement, and I quote, does not and shouldn't prevent members from taking measures to protect public health. So it was a sort of principle, policy, political decision that there was no contradiction between intellectual property protection on the one side and access to medicines on the other side.
Access to essential medicines have improved tremendously in the first decade of this century, thanks to many global health initiatives and the generosity of many development partners. Trade in essential medicines and vaccines have grown tremendously in the last 10 years, and because of many new global health initiatives providing the funding for these commodities.
The second lesson, which has a lot of parentality of what we see in WTO in other areas of trade than medicines or pharmas, is the transformation of how innovation and technology percolates into economic and social systems. One of the big differences, if we compare to 10 years ago, is that this is still an issue of innovation, but the way innovation happens and the way innovation can be disseminated at lower cost and on a larger public, many opportunities now exist which did not exist 10 years ago.
If you look at the history of international intellectual property cooperation, if you like, or international cooperation in the field of innovation, and it goes back over 120 years, you see that for the first 100 years of its existence, it really answered to its own policy imperatives. It was a world in isolation, if you like, intellectual property conventions and treaties and innovation policy at the international level. And that all changed, I think, and we entered into a second phase, somewhat paradoxically, if you like, with the TRIPS agreement, because what the TRIPS agreement did is recognise the impact of this set of policies on other areas of social policy. And it's recognised in Article 27, but elsewhere throughout the TRIPS agreement. And that really was, I think, a major shift in the landscape internationally, that wasn't quite recognised at the time, but I think was recognised in its fullness with the Doha Declaration some 10 years later, which emphasised this very important shift that had occurred. At the heart of intellectual property, and as emphasised, I think, by the historical shift of policy internationally, at the heart of it is a question of balance. We recognise that there's no good in having innovation unless the social benefit of that innovation can be shared. And that question of balance between, on the one hand, encouraging innovation, and on the other hand, sharing the social benefit of the innovation is what I believe the discipline of intellectual property is all about. And I think that has been recognised now over the course of these last 10 years, and that is a very major achievement.
In WHO, the biggest challenge for all of us is how to find the right balance to provide incentives or to protect the incentives for innovation, and at the same time to ensure access to affordable quality medicine to the poor. This is a very tricky balance.
For the future, we have to enhance our capacity for multi-stakeholder action. We have seen that developed a lot in the course of the last 10 years, but we have to enhance that capacity. And by multi-stakeholder, I would refer in particular to this full spectrum of the private and public sector, as well as the full spectrum of policy, whether trade, innovation, or intellectual property. And our capacity in this regard, it's very important that we do enhance it. Secondly, we don't need great detail. We don't need to conclude treaties to take action. I think the network society is telling us increasingly that there are many ways of having international action which don't require a treaty at the basis of it. And so the possibility of non-treaty action, I think, is a very important vehicle for international cooperation.
We started in trying to address a compatibility problem, and we now are in a phase where we are addressing a coherence problem. It was a sort of narrow problem with a sort of stiff oppositions on one specific issue. We now are looking at something which is much wider, and I think personally that coherence is something which is sort of, much more dynamic, much more action-oriented than these problems of compatibility.